Ladies and gentlemen, welcome once again to the Think Clinical Podcast. My name is Hamza. It's always great to be here. Today we are continuing our AI series. We are looking at how AI and some of the challenges that AI systems are having in the hospital. And as a leader and as a healthcare entrepreneur and as somebody who is running a hospital setting, how do you need to be measuring the quality outcomes of when you're implementing AI solutions? Because whether we like it or not, AI is becoming a part of our workflow in the healthcare sector. It is, and we can't do anything about that. But what we need to be looking at right now is that how do we measure the quality outcomes? Because when you look at these challenges, most healthcare organizations measure AI outcomes by all the IT metrics. They look at the uptime, they look at processing speed, they look at the accuracy of the accuracy rates or accuracy of the information that's coming out of them. They do not actually capture whether the AI improves patient outcomes or clinical workflows. They don't even look at that. So when we look at just this skewed view of the metrics, then it doesn't give us a really good evaluation platform for whatever we implemented. Now, so let's consider a real example. So we can look at a major healthcare system that just implemented an AI-powered diagnostic tool that has about, let's say, 95% accuracy. By traditional metrics, this is a success, correct? But then what we fail to do is that when you look into the future, you realize that physician adoption is 23%. And I have seen and I have experienced challenges like this where we implement these processes, these tools, and physicians never use them because, first of all, and if you look at my previous episodes, the notion is that these are replacing my decision-making process instead of looking at them as a decision, them expanding their decision-making process, right? So if you look at an adoption of 23% for a tool that has 95% accuracy, that success you thought you've achieved in the beginning is actually not a successful one. So when you look at something like if you look at the Vanderbilt University Medical Center, it was clearly stated, and they were very clear in saying that they've been measuring AI like they measure computers. They focus on performance metrics rather than care metrics, and this is very important. And when I saw that, it made a lot of sense to me, because when you start looking at AI from its accuracy and just the uptime and the processing speed and all these other things, you are looking at it from a performance metric standpoint, but the care metrics dimension of it is lost. So now you need to have a three-dimensional approach when you're evaluating the clinical when you're looking at the effectiveness of any AI system you've implemented. Look at this from the clinical impact, look at this from operational efficiency, and look at this from the human-centered outcomes. Look at these simultaneously, because you cannot just isolate one arm of these three and look at them without having a full view of everything else. If the clinical impact and the operational efficiency as well as the human-centered outcomes all work together, and you can see metrics in all three dimensions going up, then you can actually say that whatever AI system you've implemented is a successful one. Okay, so let's look at these dimensions. One, the clinical impact. When we look at clinical impact metrics, they focus on patients' outcomes and care quality, right? So there are metrics that matter most to the patients and the clinicians. So clinicians are, by virtue of their training, inclined to lean towards any tool that will improve patient outcome that has clinical impact, right? So we are looking at things that are directly going to influence the quality of care that they give as well as patient outcomes. So when I talked about the Cleveland Clinic sepsis detection, AI-powered sepsis prediction system, I stated that this actually helps a lot of physicians or the hospital to be able to improve how quickly they're able to pick up septic cases. Way earlier. And then when they were looking at this, they looked at this with four metrics in mind. They looked at the time to sepsis identification, because the earlier you diagnose, the better the outcome for patients and the chances of you reversing the potential mortality. They looked at the mortality rates. Are they going down? They looked at hospital length of hospital stay, and they also looked at readmission rates. These were the four metrics that they looked at. They just didn't pick one thing to focus on. And the results clinically, so I'm still talking about clinical outcomes and quality of care. The results clinically were very dramatic. So sepsis mortality decreased by 18%. Average hospital stay shortened by 1.5 days, 1.5 days, and then 30-day readmission rate dropped by 12%. So this gave them a more holistic view of that system that they implemented. Now, here's the sophisticated part. They also measured near-miss events. So the AI system generated over 2,341 sepsis alerts over a 12-month period. And while only 34% of these were confirmed sepsis cases, the other 66 remaining were clinically actionable items that were going to be near misses. There were patients with early detection of early infections, which didn't meet the sepsis criteria. There were patients who were dehydrated, who would have been missed, and there are other conditions that required intervention. So, even though out of the 2,341 patients that were flagged, only 34 of those were actually diagnosed with sepsis, there was also that advantage that it brought of helping the hospital to be able to identify near misses. Those that had early infections that could actually progress into septic situations or probably even mortalities, or those that were just dehydrated and needed to be rehydrated, or it could lead to other things. So they really expanded how much of what they measured when they implemented this system. Now, Johns Hopkins even took this further with their AI-powered medication management system. And they measured not just the prevented medication errors, but also adverse drug rates. They measured patient adherence, and they measured clinical outcomes like blood pressure control or HbA1c. Now, the system prevented 847 potential medication errors in its first year, but more importantly, patient clinical outcomes improved by 23% across all the chronic disease spectrum, right? So again, clinical impact metrics must capture both direct AI effects and indirect improvements in overall quality of care. So the first dimension, which is clinical impact, this is how institutions that have been successful with AI have been able to implement this dimension of it. Now, when we look at the second dimension, which is operational efficiency metrics, they evaluate how AI can change the delivery workflow and the resource allocation or utilization. Now, so these metrics directly impact the financial sustainability of the organization as a whole. So Stanford University, again, with their AI-powered study, they had a scheduling system that was AI powered, and they decided to look at this and measure the following. They looked at patient wait times, they looked at provider utilization rates, and they also looked at appointment scheduling accuracy. These were the three things they looked at. They looked at patient wait times, they looked at provider utilization rates, and they looked at appointment scheduling accuracy. Now, what they found was that wait times decreased by 34%, provider productivity increased by 22%, and scheduling accuracy improved by 98.7%. That's huge. But the sophisticated measure approach goes deeper, because they also tracked what they call the cascade effect. Now, how AI improvements in one area would impact other operational metrics. So, for example, if you have better scheduling, they will improve patient flow, which probably reduced emergency department by 16% and also increase patient satisfaction. So that's the cascade effects they also started looking at. So if you look at these, hospitals are taking these AI implementations and looking at them in a way broader view than most of us do. And I've been a victim of this, where we've implemented AI systems, but we haven't really given them that broad overview of what they need to be, right? So if you also look at the Geisinger Health systems, which measures operational efficiency through their AI impact dashboard, it is a real-time system tracking 47 different operational metrics across the AI implementations. Their clinical decision support system reduces average diagnosis time by 23 minutes, and it also translated to seeing 2.3 additional patients per day per physician. So look at how they've been able to lay out the operational metrics that they need to look at. The financial impact was significant because they calculated their AI implementation, which generated 12.4 million in operational savings over an 18-month period through reduced length of stay, improved resource utilization, and decreased readmission. So just look at this from a real-time tracking system, which is looking at 47 different operational metrics, and they are looking at that cross and even all the cascading effects that it could have on everybody. Now we go down to the human-centered outcomes, which are where most healthcare organizations fail. Now the first two, a lot of the time, the health organizations are able to measure them really well. The human-centered outcomes are where they fail to measure. And these focus on how AI impacts the people who use it. So the physicians, the nurses, and other healthcare professionals. How is that system that implemented? How does it impact them? This is how Mayo Clinic approach was exemplary. They measure physician satisfaction with AI tools, burnout scores. They look at time spent on meaningful patient interaction and job satisfaction ratings. Now, Mayo Clinic has been able to implement this and take it to the next level. So their AI-powered documentation system reduced documentation time by 44%, and more importantly, it increased patient interaction time by 2.7 minutes per encounter. So now, when you look at a statement from the Mayor's former Chief Medical Information Officer, he explained, and this is exactly what he said. He said, we learned that clinicians don't just want more time, they want more meaningful time with patients. So our AI measurement framework captures both the quantitative time savings and the qualitative improvements in physician relationships. So this is how and where most organizations fail when they implement these systems. We also have the University of California, San Francisco, which implemented what they call the joy in work metrics for their AI systems. So they track physician stress rate levels, work-life balance scores, and they look at professional fulfillment measures. And their AI clinical decision support system not only improved diagnostic accuracy by 19%, but it also increased physician confidence in complex cases by 31%. But here's the crucial measurement of innovation. They also tracked unintended consequences, and these are things that we need to be looking at. Some AI systems that save time created new types of work or cognitive load, because that is something that most organizations don't look at. So you look at the fact that I've given you this tool, but there are unintended consequences to it. So the framework captures the negative impacts, allowing for system refinement before the widespread deployment. So when you look at nurse satisfaction metrics, which are equally important, we have places like the Cedars-Sinai, where their AI-powered patient monitoring system reduced false alarms by 67%, and leading to 42% improvement in nurse job satisfaction 23. So when you look at these human-centered outcomes, they're important for you as an organization to be able to make the decision that you need to make. So this is the integrated measurement framework that I want to present. So when you have a leading healthcare organization that are now using integrated measurement frameworks, they combine all three and they provide a holistic view of AI impact that supports both clinical and business decisions. So this is what they do. So Kaiser, for instance, they have their AI measurement dashboard which tracks 73 different metrics across their AI implementation, from clinical outcomes to operational efficiency. But the key innovation in their correlation engine is a system that identifies relationship between all the different metrics. So for example, they discovered that AI implementations with high physician satisfaction score had a 34% better patient outcome improvements than those with a low score. So you are integrating all the three arms, the clinical side, operational side, and the patient or the human-centered metrics. You are combining them to be able to get one full metric. And the measurement framework also includes predictive analysis, which by tracking the leading indicators like physician adoption rates and user satisfaction scores, they can predict which AI implementations will succeed before clinical outcomes become apparent. So when they just look at the adoption rate and all that, they can say, okay, these ones are the winners. These AI tools we know are going to be successful before anything else. Now, when we look at their sepsis prediction AI, which is a perfect example, when early measurements showed that there was high accuracy but low physician adoption. So instead of declaring success based on the technical metrics, they redesigned the user interface and alert system. 6 months later, they started seeing physician adoption increase by 89% and clinical outcomes improving dramatically. So these are things that we need to be looking at, and we need to be sure that we have in place to be able to get this. So based on the implementation across some of these healthcare practices, here are 5 best practices for measuring AI quality outcomes. The first one is establish your baseline metrics before any implementation. So identify where you are with all these metrics that we've been able to identify exactly what you want to be looking at in terms of the clinical impact, in terms of operational impact, in terms of the human-centered impact. Now, secondly, you have to use a balanced scorecard that prevents metric gaming. So this, if you only measure one diagnostic accuracy, you might get accurate results but unusable systems that are not friendly to people. You only measure physician satisfaction, again, you might get popular but it's ineffective too. So don't always use a balanced scorecard when you're looking at this. That's the second point. The third one is to implement real-time measurement dashboards and making sure that monthly reports are optimized in real time. And then make sure you improve the fourth arm of this, which is to include all patient-reported outcomes. Make sure these are there. That provides that transparency. And the fifth one is to measure the measurement system itself. What I mean by that is that you need to track the cost and effort required for your measurement framework, because sometimes we forget that we are spending money in measuring all those things that we need to measure. So you need to go be able to measure that measurement framework. So in summary, AI quality outcomes isn't just about evaluation, it's about making a strategic decision. And the organizations that excel with AI measurements or better implemented achieve higher adoption rates and deliver way superior patient outcomes. So remember, what gets measured gets managed. So you need to identify and make sure that you're measuring in all these categories, and then you can manage them when you need to. If you only measure technical metrics, you get technically successful and clinically irrelevant. Again, if you measure technical metrics, you will only get technically successful but clinically irrelevant. Now, if you look at, if you measure holistically, clinical impact, operational efficiency, and human-centered outcomes, which are the 3 main arms, you will build AI systems that truly transform the healthcare system. So the future belongs to the organizations that measure not just what the AI works or what it does, but whether it will people that matter the most, which are the patients, the physicians, and the healthcare teams. Ladies and gentlemen, this has been another very exciting episode of the Think Clinical podcast. Remember to subscribe, like, and share, and we will see you again in our next episode, in our next series on all these AI systems that we are trying to provide insight for. Have a beautiful day.